Taiwan is considering easing quarantine rules for recovered COVID patients who later test positive for the virus at its airports.
Officials say that as COVID spreads globally, more and more such individuals will show up at the border. They're drafting up rules to allow early release from home isolation for recovered patients who are no longer contagious.
Even as Taiwan's border restrictions remain firmly in place, imported COVID-19 cases are continuing to trickle in. In some cases, travelers tested negative for COVID twice before flying to Taiwan, only to test positive upon arrival. The CECC says that unnecessary contact tracing comes at a cost and is a drain on medical resources. The CECC is considering easing the criteria for early release from isolation. First, the person should have proof of a negative COVID test provided by a reliable source. Second, the person should have a CT value of at least 34, and substantial time should have passed between the patient's diagnosis abroad and their arrival in Taiwan. Finally, the patient must have COVID antibodies. If all three conditions are present, the arrival won't need to complete all 14 days of quarantine, and their contacts too may be released early.
If the person has a high CT value in the very first test, this person would not necessarily be categorized as a confirmed case, because it's possible that the person is still in the process of recovery after a prior infection, and that their body contains traces of nucleic acids. If a test for antibodies comes back positive, it means the person was infected at least 2 or 3 weeks ago. How long that person needs to be isolated is still something to be discussed.
Experts have reached a preliminary consensus on a protocol for early release, but its details must still be finalized. The CECC says it has no timetable for a rollout. Meanwhile, countries around the world are already lifting border restrictions. The U.S. Center for Disease Control has announced that people who've been fully vaccinated for COVID can forgo their face masks in small indoor gatherings with other vaccinated individuals.
The effectiveness of the U.S. vaccines is 94 to 95%. Say that 2 people are vaccinated. It's extremely unlikely that the vaccine is ineffective for both of them. At least one of them will be protected, so the disease would be unlikely to spread. But the circumstances in Taiwan may be different. In Taiwan, there may be several different vaccines administered. We can't compare ourselves with the US yet. What they've done is reasonable enough. They have worked out the probabilities.
Taiwan's first batch of 117,000 AstraZeneca vaccines is still under inspection. Their impending rollout raises hopes of a return to big gatherings and global travel.